Hello, this is Paul Pachter, the Chief Executive Officer of Long Island Cares and the Harry Chapin Regional Food Bank. Welcome to the DDBR Kitchen Studio and our very first broadcast of our new online program, Breaking Bread at Long Island Cares. Twice a month, we're going to post onto YouTube, our YouTube channel, interviews with important people, the staff of Long Island Cares, the leadership of our organization, as well as corporate business leaders, politicians, elected officials, everyone that has something to do with making this organization such a wonderful place to work and make our services so meaningful to people in need. And clearly, when we talk about food insecurity on Long Island, there are 272,000 of our neighbors in need, and that includes 77,000 children. So let me take you behind the scenes right here at Kitchen Studio and welcome our very first guest. I am so pleased to welcome Mike Haynes, the Chief Government Affairs Officer for Long Island Cares, here at the DDBR Kitchen Studio for the inaugural broadcast of Breaking Bread. Mike, I'm very excited that you're here. One of my goals in hosting Breaking Bread and inviting people like you to the program is to take people inside Long Island Cares, to understand the extent of the work we do and how we help so many people in need here on Long Island. So I thought we'd begin with your title, which is Chief Government Affairs Officer. What does that mean for the Regional Food Bank, and in particular, what does it mean for Long Island having you out there as the Chief Government Affairs Officer?
Okay, well, what it means is that I handle our legislative advocacy efforts, which includes writing letters to elected officials. It could be developing memoranda. It could be posting things on social media to get out to our network of dedicated advocates. It also could be helping to set up press conferences with elected officials to highlight issues, as we've done recently, to highlight the impact of the federal government partial shutdown. Mm-hmm. I also have a pretty integral role in veteran services.
Well, we're going to get into the veteran services in a minute or two, but let me focus for a minute on this role of advocacy. There's a thin line that people will say between advocacy, between lobbying, trying to influence people in the way they vote in Albany and Mineola and Hauppauge and Washington. From your perspective as the Chief Government Affairs Officer, I have two questions. Number one, what is the role of advocacy for Long Island Cares? And second, looking at 2019, what are some of the priorities that you've established for our organization to speak out about?
Well, I see the main role of advocacy as education, to educate our legislators and educate our public on really the true status of hunger in the region. And, through education, a lot of times you don't even have to make the advocacy ask. Mm-hmm. When people see the true picture, when they see that 272,000 friends, neighbors, and coworkers are struggling and don't know where that next meal is coming from, they then go back to Washington and ask for more support for federal nutrition programs. They go back to Albany and see what they can do to help support their local food bank. Mm-hmm. And also, too, really when you publicize our efforts and the true status of hunger, it really mobilizes our advocacy base. Our advocacy base is made up of a lot of dedicated volunteers, also people who were touched by our founder, Harry Chapin. And really, it gets them to call their elected officials and say, what are you going to do about hunger on Long Island? What are you going to do to get the government back to work? And that really, hunger, sadly, here in such a high cost of living area is kind of a hidden issue. And that's a good point. I see advocacy, in addition to educating, as its main role to illuminate this issue and get people talking about it, because that's the only way change is going to come about.
Yeah, I think if you look at advocacy and hold it up against awareness and the education piece that you spoke about, that's probably one of the best definitions I've heard in a long time. People think about advocacy, there's a few hundred people outside this legislative office and they're carrying posters and placards and picket signs. But the way you put it, of raising awareness and heightening people's understanding of the issue of hunger and food insecurity and poverty. That really does, put it into perspective for people to better understand and perhaps even support our role. There's a lot of legislators on Long Island, both local, state, and we have 5 people or 4 people representing us in Washington. In the work, in the time that you've been doing this work for Long Island Cares, in general, do you find our legislators and elected officials responsive to what you're putting in front of them, whether it's in a meeting or a letter?
I find the Long Island legislators to be extremely responsive and extremely supportive. They realize that hunger is a nonpartisan issue, that it's a human issue, and regardless of party affiliation, on some level, all of our county, state, and federal officials have reached out to us and seen how they can get involved. A lot do food drives, many more do pet food drives in addition to their food drives. Several call us and ask us what we're seeing. Several respond to our letters when we, ask them about the status of the Farm Bill, when we ask them to, when we inform them of the impact of proposed changes to SNAP and how that would hurt the people we serve. They ask for data and they ask for what we're hearing from our clients and our satellites. And it really means a lot. And it's we're very lucky because when I go to Feeding America conferences, when I go to DC, and I tell them that Governor Cuomo's been in our warehouse, that Senator Gillibrand's been in our warehouse, that we've had Congressman Peter King in one of our satellites, they don't believe it. They go, man, I'm lucky if I get the town mayor to come. And, it means a lot. We're very, very supported. And, both county executives do food drives and have volunteered here. There's too many legislators to list that have come to Long Island Cares and asked how they can help.
Yeah, I would echo exactly what you're saying. And, I think it's important for people that are watching Breaking Bread right now that the entire Long Island delegation, whether it's in Hauppauge, Mineola, Albany, or Washington, understands this issue. They've reached out to us on numerous occasions through you. As you say, you have people on the right, people on the left that have been here because, in their heart of hearts, they want to help. We're now in 2019. We've heard the governor's State of the State message. We recently had the opportunity to hear both Suffolk County Executive Balone and Nassau County Executive Curran speak about their priorities. The State of the Union address may or may not be held sometime later this month. You prepare for Long Island Cares a legislative agenda. What are 2 or 3 of the major topics that we're looking at right now moving into 2019 that you're going to be advocating for on behalf of the organization and on behalf of the 380 member agencies that we support?
Well, one thing that we got a lot of good press on in recent weeks is the unintended result of the trade war with China and how that led to trade mitigation purchases by the USDA and how that actually led to America's farmers donating millions of pounds of commodities in addition to what they already do to the nation's food banks. And that's going to lead to, I believe, an additional 2 million pounds of commodities at Long Island Cares this year.
Absolutely.
And one thing that we've been vocal about is advocating for, we're so grateful for this additional food that's going to help us meet the need. And at the time, we had no idea a government shutdown was going to occur and the needs are increasing.
Right.
But there's costs associated with storing and distributing this food. So that's one thing that we've been active about of, how can you support us, because we have a mission to get this food to our agencies. And we have agencies in Elmont, Valley Stream, and all the way out in Montauk. And there are costs associated with warehousing and distributing these foods.
Right.
And also too, especially with the shutdown, we don't only advocate for ourselves, we advocate on behalf of our clients. And we know that the SNAP program, people will be receiving their benefits through February. In many cases, they've already received it. But we are concerned about people possibly losing their SNAP benefit starting as early as March.
Yeah, it's a real possibility. And you said something very important that I think people watching Breaking Bread should understand. This is, when you talk about advocacy, this is not just about Long Island Cares. This is about the 272,000 Long Islanders who rely upon the services of 380 community-based organizations, pantries, soup kitchens, daycare centers. So, although we're recognized as a regional food bank, we're really speaking on behalf of the network. And, I think more and more through your work here, you've engaged a lot of our member agencies in advocacy efforts, and that has proved to be very helpful. Let me switch gears for a second, because I think, we have a clear understanding of what you're doing out there as government affairs officer, but you're also one of the lead people here at Long Island Cares to make sure that our veterans, their families, military personnel are supported and receive any assistance that they need. As you've mentioned many times in public, and you've mentioned it in the paper and at board meetings, Suffolk County ranks number 2 in the nation for the highest concentration of veterans in the United States. And we don't have an active Army base here, and we're second only to San Diego, California. So, and we have a very robust Veterans Outreach Service program. So, let our viewers know, what is our Veterans Services program all about, the Veterans Project, and how would veterans and their families access it?
Well, I think the crux of our veteran service programs is tied to one of our most successful programs, the 3 emergency satellites we have out in the community.
Agreed.
And every Tuesday, we serve primarily veterans, active duty, military families. And I think it's pretty cool too that we don't differentiate between the veteran and his or her family. I think that's important, and I've seen in different situations, military spouses or military children frustrated that they couldn't get this benefit because they weren't the actual veteran. And every Tuesday between 9 and 5, whether it's in Huntington Station, Freeport, or Lindenhurst, veterans come to us and they basically go grocery shopping with the help of a volunteer. And in most cases, that volunteer is a veteran, him or herself. And, they build up relationships. And they also, it seems like they come at the same time, and, they know when they're waiting in the lobby that they're going to see some people that they've become friends with over the years. Some veterans come weekly, some veterans come monthly, some veterans come, really only when they truly need it, and it might only be a handful of times each year. But when veterans come to our satellites on Tuesday, they receive, their staples, they receive non-perishables, they receive fresh produce, they receive proteins, but they also receive things that if they are SNAP clients, that they can't use their SNAP benefit on.
Right.
They receive things like paper towels, toilet paper, personal care products, and even pet food. And what's pretty cool too is if you can't come to us, we can come to you. We have a veteran mobile outreach unit, which has distributions at the VA hospital, has distributions in conjunction with the Suffolk County Department of Veteran Services, and also the Nassau County Department of Veteran Services. And also too, we build relationships and partnerships with various veteran service organizations, and we do distributions with SUS, Services for the Underserved, EOC, Boots on the Ground. And really, if you're helping veterans and we can help you, we will.
I looked at recent statistics for components of our Veterans Service program, and I was really surprised to see that nearly 1,100 veterans are known to Long Island Cares, either by attending our satellite centers on a weekly or monthly basis, or having received services through your collaborations with the various veteran service groups in the community through mobile outreach. And, then there's over 100 veterans who you and your team have been able to place in competitive employment through the Vets Work project. Talk a little bit about Vets Work and what you've been able to achieve in, is it the last 4 years?
4.5.
4.5 years.
Well, we always, as we've grown as an organization, we've placed more of an emphasis on data. And through the data, that causes us to issue surveys. And we survey our veteran population. And when we saw such a growth in the number of veterans coming to us for assistance, we surveyed them and we asked why. And the number one cause was either or underemployment. And then we realized we had to act. And through a generous grant from a private donor, we started Vets Work. I hired a very capable and passionate veteran life skills specialist named Fern Summer, who really assists veterans that primarily we meet them as the veterans that come to us on a weekly basis. But we also, being so integrated with the veteran service agencies throughout Long Island, they do refer people our way as well. But Fern meets with the veteran, helps them to craft a resume, helps them to, refine their cover letter. When through our pretty in-depth assessment process, we see what they're qualified for, what they want, what they like, and where they can go. Through all these meetings, we help them apply. We let them know about job fairs, we take them to job fairs, we help them develop their elevator speech, we mock interview, we have trained people on the computer, we've also let them know about different training services, even entrepreneurial training programs that some of the colleges like Hofstra or Suffolk or Nassau Community College have. And through this, we've helped 108 veterans to date find employment, and more than that too, we've addressed a lot of the barriers to employment. If a veteran was concerned about their ability to work because they had some sort of issues at home or lack of an access to health care, or they needed some sort of, let's say they were having problems with their kids, being such a large nonprofit with 380, 390 different community partners, we know where the veteran can go for those other services. So when they get those services and everything else taken care of, then they can focus on going back to work. And the best thing about Vets Work is, we build a rapport and we develop relationships with the veterans, because a lot of times they're in need and they come to us each week. But when Vets Work truly succeeds, it's sad, but we don't really see the veteran that much anymore. But they email us and occasionally call and say thank you and let us know how they're doing, how their kids are doing.
One of the pieces of your work, you and Fern in Vets Work, is this ability when you're doing the assessment of the veteran to look at their military skills and their military experience and convert that to civilian life. And I think, one of the areas where you have been most successful is meeting with potential employers and letting them know that, just because a veteran might have been involved in logistics in their particular division of the military doesn't mean that it's easily transferable to the civilian sector. The same would hold true that if if one of the veterans who comes to Long Island Cares was in an infantry unit and saw combat, doesn't mean just because he can hold a weapon that he's a good security officer. So, that's been something that I think a lot of people, especially the donors who support Vets Work, have seen you and Fern be able to, help veterans make this transition in terms of career from military to civilian. But I want to get into another aspect. 1,000, almost 1,100 veterans coming to Long Island Cares, receiving assistance. You mentioned earlier, many of them receiving SNAP benefits. And a lot of people, would hear that and say, I can't believe our veterans are receiving food stamps. Why? Why are they going to a food bank or a local pantry? Well, those reasons, so maybe help our audience understand what are some of the challenges facing veterans and their families on Long Island today?
I think just reintegrating back into civilian culture is tough. For as long as you served, your whole life was scripted. You knew what you were doing, as soon as you woke up to the time you went to bed. And, you knew when you were eating, you knew when you were running, you knew when you were doing PT, you knew when you were taking classes and training. And, now you're back here and you kind of don't know what to do. And, that lack of an immediate sense of purpose, or even just the overwhelming nature of the freedom of you don't have to do this at that time leads to people sometimes not knowing where to go and what to do. And also a lot of times what I hear, and I should have started with this, is the camaraderie that they had, that when they come back home, that they don't have anymore. Because when their friends went back home, they went back home to Kansas or Alaska or California, and their friends who stayed home when they went and served, they don't have that much in common anymore. So that can lead to isolation, and depending on whether they utilize the GI Bill or not, it's hard to know what you qualify for and where you can go to work, and that leads to some confusion. And to top it off, a lot of people get hurt in the military. And sometimes they don't admit that they got hurt because they want to be out there with their brothers and sisters fighting and helping. But then they go back, and that small ailment in their leg gets worse over time. And then if they were looking for a job that was more physical in nature, they might not be able to do that. So you have the health care issues, the mental health care issues, the lack of camaraderie, and also, immediately the military isn't the most high-paying job. They're not coming back with a lot of money in most cases. And if they don't have family support, they can start off in a bind.
And I also think it's important for people to consider that when a veteran does multiple deployments, meaning, they've served 2 or 3 times in Afghanistan, or they've been in Iraq 2 or 3 times, it's even more challenging, because once you get home and you try to stabilize your situation physically, emotionally, financially, then, a month, 2, 3, 6 months later, they're going back on a plane and going back to, back into the theater of operation. You're working with hundreds of organizations on Long Island that provide services to veterans and their families. I would imagine that entails people who are working with the Veterans Administration, looking at the needs for housing, medical care. In collaborating with so many organizations, how do you keep it together? How do you keep the communication, open and, fluid, in order that we're all together, we're working for these veterans?
We're a member of several different groups. We're a member of the Veterans Health Alliance of Long Island, and they do a pretty good job of convening the veteran service organizations for Long Island.
Okay.
I'm also the co-chair of the Town of Huntington's Chamber of Commerce's Veteran Committee.
That's outstanding.
Their Chamber of Commerce is really active in veteran employment, and also in supporting organizations like Long Island Cares and other nonprofits. You can't really talk about veteran services on Long Island and not talk about the Northport VA and the work they're doing. And also the leader of the Suffolk County Veteran Service Agency, Tom Ronayne, and also the leader of the Nassau County Veteran Service Agency, Ralph Esposito. I think we all, through our work, see each other at the job fairs, the veteran stand-downs, the days of wellness, and the veteran barbecues and other things put on by legislators. And over time, you know who the key players are, and you refer people to them, and they refer people to you. And there is a very collaborative relationship, and it definitely can improve. And what I think the biggest challenge is that there are privacy and confidentiality concerns, and we're nonprofits, we're not the healthcare sector, and we don't have shared software, so it's kind of hard to track those referrals. I might say, hey, thank you for coming to us for food. You really got to talk to a veteran service officer at Suffolk County Division of Veteran Services. But unless I see people from that agency, I might not find out if they went there. And I'll ask when they come back to Long Island Cares, but sometimes you don't know, and sometimes people are in a rush, and sometimes people might not want to disclose information.
So sometimes it's difficult to do the necessary follow-up that would, close the ring, close the circle. So let me finish up with this question. Looking forward, what do you see in the next year or so as an important piece that either Long Island Cares or other organizations in the region can do to help our veterans in need?
I don't know what the solution is, but I think I know one of the major problems. It's transportation. For veterans that don't have cars or don't live with someone with a car, we see a lot of veterans in our Huntington Station satellite before or after their VA appointment, because the VA is pretty close. And sometimes we hear the stories about, I took a train, I took a bus, I took another train, and then I had to take a cab, then I took the train back. And, to come to Long Island Cares for a half hour and to go to the VA for an hour, it's a full day.
Absolutely.
And they're also exhausting limited budgets. And, it's sad. And it leads to some veterans who are in need of things postponing addressing them or not addressing them at all.
So certainly transportation and the availability of public transportation, flexible schedules, would be able to greatly improve a veteran's ability to receive services. What would be the best way someone in the community that wants to either get involved, make a referral, or even support our work with veterans, what's the best way for them to reach out to us?
I would say, I'm very proud of the work we do at Long Island Cares. But I would say at first, do some research, go on our website, see if you like what we're doing. And, if you do, give me a call, give me an email. All our information is on the website. A description of our veteran service programs is on the website. And we also have volunteer registration forms. You can, when you fill out what you're interested in, when you want to volunteer, you can say you want to help veterans.
Oh, that's excellent that people know that they could support our Veterans Project directly. This is the information. It's available on Long Island Care's website at licares.org. We do have a generic main phone number for all our services, which are 631-582-FOOD. That would be 582-3663. We've been breaking bread today with Mike Haynes, Chief Government Affairs Officer for Long Island Cares, talking about our government relations program, our advocacy work, our education work, and also talking about our veteran services, mobile outreach, vets work, employment placement, and preparedness program, and all the other good stuff that we're doing right now with close to 1,100 veterans. Mike, I am absolutely overjoyed that you have helped us launch Breaking Bread. I want to invite you who are watching us right now on YouTube to consider Breaking Bread as well, to help the 272,000 Long Islanders, over 1,000 veterans who are utilizing our services. As Harry Chapin said, to know is to care is to act, and to act is to make a difference. If you've enjoyed what you've just seen, please like and subscribe to the Long Island Cares channel right here on YouTube. Until next time, thanks so much.